Welcome! This video is a basic demonstration of serological crossmatch. The serological crossmatch will utilize two key components: a whole blood patient sample collected in an EDTA anticoagulant tube and a unit of red blood cells. An administrative step is necessary for verifying that type and screen results are complete and up to date for the patient sample in hand. Additionally, the lab information management system will display any additional transfusion-related requirements like irradiation, history of bone marrow transplant, and clinically relevant red cell antibodies. This patient has a red cell antibody known as KEL, abbreviated anti-K. Anti-KEL is one of many antibodies that can initiate a severe and possibly life-threatening immune response in a patient. For all patients, ABO-RH compatibility is the first selection criteria, followed by antibody history, cytomegalovirus or CMV, with irradiation and/or washed as the last transfusion requirement. As we can see, both units are ABO-RH compatible. Since our patient has anti-KEL, it is important to select a red cell unit that has been serologically tested for the KEL antigen, which has already been performed with these two units. One unit tested negative for KEL, while one tested positive. Ordinarily, the KEL positive unit would not be selected for crossmatch. For this demonstration, however, it is important to see how the selection criteria impacts the serological crossmatch. Immediate spin crossmatch is necessary to discern ABO-RH compatibility among a patient and a unit of red cells. This technique is adequate for patients without a history of antibody. Donor identification number stickers are used to label the tubes in addition to the patient's initials. Every red cell unit has segments that can be detached to make a 3 to 5% red cell suspension. One drop of the suspension is added with 2 drops of patient plasma, then spun in a centrifuge. The immediate spin crossmatch is evaluated with an optical aid. As we can see, both units are ABO-RH compatible to the patient. For patients with a history of antibody, it is critical to perform what is colloquially referred to as a full crossmatch, which requires a 37 degrees Celsius incubation. Polyethylene glycol, abbreviated PEG, is a commonly used reagent to speed up the incubation time of the crossmatch. Additionally, PEG can enhance a weak or difficult to visualize serological reaction. PEG-enhanced crossmatch tubes are washed a minimum of 4 times with buffered saline. Prior to the addition of anti-human antiglobulin, or AHG for short. AHG reagent allows us to evaluate the serological crossmatch. Tubes Tubes with agglutination are considered incompatible at AHG phase. Coombs check cells are added to tubes without agglutination, then centrifuge. Check cell agglutination confirms the negative result at AHG phase, which equates to a compatible serological crossmatch.